Okay, you're welcome back to Mental Health Show with James Osuntoogun. You call me MC JERRYJAY, and we still have live in the studio a mental health professional from the Federal Medical Center, Abeokuta, in person of Dr. Tosin Lawal. Thank you for still being with us on the show.
Thank you.
Yes.
I'm enjoying the program. I hope we're able to pass message across.
Oh yeah. Before we went on the break, you were talking about the differences between treatment and cure. You spoke about that, and I asked about can people who have mental illness can they still live their normal life? Can they get married without having the fear of having to transfer the genetic issue to the offspring?
Yes, in terms of that, you know, once they are able to um, do what they are supposed to do in terms of having a right attitude to the bipolar illness that they have, they can live to their, as in they can live their normal lives.
Mm,
So they can get married, they can do whatever they want to do. Yes, if by chance it is passed on to their offspring, which will be, because they are aware that okay, this can happen. So they
okay.
tend to be able to want to they tend to watch the child
Mm,
at a very young age, at a very and then so they are in contact with the health professional, so they are able to nip it in bud, even if the child has like the the susceptible genes to
to exhibit.
to
Okay.
exhibit bipolar illness. So they are able to nip it in the bud. The symptoms might not be that bad for somebody that is totally unaware or
Okay.
something. So they can actually they can live their lives. They
Okay.
can live their
Um.
they can marry, they can, but as I said, once they have it and they notice that oh, this child is having such and such behaviors,
Okay.
they report to the health professionals, and that is nipped in the bud early
Okay.
before developing into any full blown mental issue or something.
Okay. Sorry, Dr. Tosin. I would like to ask you a more personal question.
Okay.
You are a mother.
Mm.
Um, you being a mother, would you advise your own son to get involved with um, someone who was previously a patient of mental illness, probably now treated, just like we spoke about earlier,
Okay, so
as a mother?
it depends on the circumstances involved, the type of mental issue the partner has, my children, the kind of mental issue the person has,
Okay.
the kind of attitude the the person has towards that illness, and to an extent what the spouse, I mean the supposedly spouse family has towards the illness, that would
Mm,
determine that okay, are they that supportive, are they that understanding
okay.
for it to continue. If all that is in place, is in check, why not? Why
Uh,
not?
you would
Because it's a
agree with
type of
me?
illness. There are several types of illnesses that are around in this world. People have leukemia, people
That
have
is not
all
even
sorts.
pronounced.
That is not even, some of them are pronounced, and
Okay.
some of them are even life
Eating.
threatening, that
Hmm.
that oh, this person will die But
Okay.
some, it's just an attitudinal or a behavioral problem. It can
Okay.
be contained, for crying out loud.
Oh, you would
So
agree with me that you are a medical professional. You would understand this. What if the attitude of the family of the supposed spouse is not as enlightened as you are, and so they are not having a good attitude, quote and unquote, as you said?
so
Would
if
you be in place to make an
that's
advice,
that's what I
or you
if
would
so if
disembark
okay, so
totally?
if the family, because if a family the family has a very, very pivotal role
Mm,
in supporting those with mental illness, and especially when it comes to the marriage,
okay.
the marriage, how do I put it, the marriage setting.
Okay.
So for such, if the family doesn't have um that they are not that enlightened, and you've tried to enlighten them, you've tried to, and they are still not, the belief system is still awkward and all that, I think it's better
Mm,
for you not to go further in, because if they are not understanding, even if you try to help them, even if there are issues that you want to do. So you have your beliefs, your thoughts, your ways of doing things don't tally. So why would you want to? So that's it. So even that's in anything in life. So even apart from talking about mental issues, so to say, if you don't have people that that would understand you, that you do things in similar ways, why go into a relationship of life? Why? So that's what I think. Okay, but although not the children can say, maybe it's our life. It's our but it's more than that.
You as a professional would be in place, even if they are no longer dependent. You would be in place to still give an advice, even if you cannot make a call of judgment for them.
Exactly.
Okay. Yes. We're dealing with bipolar disorder on your mental health show with James Osuntoogun. And here with me is a mental health professional from the Federal Medical Center, Abeokuta. And if we have these manic ups and depressive lows, um, how can we identify the triggers for these switching phases? Because uh, you would also acknowledge the fact that there are triggers that actually brings in these phases, or do you think they just come without any triggers?
Usually that we want to identify that, we call them stresses or triggers, as you said. So we usually want to identify the stress that could have caused this particular that could have triggered a particular episode behind. We want to identify it. Is it a biological stress? Is it a social stress? What could it be? So that because if the stress has not been dealt with or has not been removed, the person will still be in that phase, even with all your medications and all your treatments. So we want to identify the stress and remove it. So that's where our history taking is so detailed. When you are clocking somebody with mental issues, we spend hours trying to figure out what could have caused it, what could have been the etiology. So we ask a lot of questions, deep questions, family, everything. We go so in depth in trying to find out what could have been the cause of why this person is coming down with this illness at this particular point in time. We ask a lot of questions. So it's the history taking, which I said it takes a lot of hours.
That is even if the patient is responsive.
Exactly. Even if the patient is not responsive, it takes a while. So your assessment cannot just be one time meeting the patient. So it can be more, it can be more than one assessment. Of course, you assess the relations, the people that are around him, the people that are surrounding, the people that know him before the illness. That's to asking them questions is a form of assessment. So and then when the patient is better, you keep trying to find out why the patient came down with that particular illness till the patient get better. Even on the last day, I feel that everything is fine. You still and you are not convinced of what is the actual trigger. You still keep trying to probe what could have been the cause. So usually we just find that this person has come down with this particular illness, or some events could have happened that maybe and one would have suspected maybe that would be the cause, especially for people that especially for people that had a relapse before. So if something like maybe somebody died, or he lost someone, or lost a job, or so all those kind of things, you try to want to, and you know that the person has been relapsed before. So when such things happen, when such big stresses happened, you want to try and quickly, try to ameliorate it, try to give supportive therapy, try to make the stress as to be reduced as possible.
Okay.
Do you understand what I'm saying?
Yes, I do. I was involved with a situation like this while we were 7. I would love to change the names of people involved with, and then Okay, let me use Rufus. Rufus happened to be a colleague while we were serving. Rufus showed a good gesture to, let me use Cynthia. And then, because of the good gesture, we noticed that Cynthia is always keeping to herself, always in that extreme depressive mood. And then the good gestures made her switch from that phase into the extremely happy phase. Now, there was a misconception for the good gestures to mean a proposition of affection. And then we suspected a kind of uh, obsession, sort of, such that if Cynthia does not see Rufus, it becomes a problem. Asks about him, if no matter who is standing there, no matter even if it's a soldier carrying life ammunition, Cynthia doesn't care as long as she sees Rufus, or she makes everybody know that Rufus is not around and she needs to know where he is and she needs to find him. It got so bad that this situation we had to first involve the law enforcement because it was becoming life threatening. Cynthia couldn't stand anyone close to Rufus. It got to a situation where she got acid to say she was going to debeautify or demean someone who was being associated with Rufus. You know, in such a situation, how do you think it could be handled?
Okay. So that one could be in form of as in Cynthia stalking
Rufus,
Rufus.
yes.
And it could be that she has sort of like a delusion or something, that's still a form of psychosis also. So those could be as in those um, sort of symptoms could be involved. Is that Cynthia is psychotic,
Okay.
or Cynthia is psychotic and stalking
Rufus.
Rufus?
Because in this situation, when NYC knew about it, she was posted back to a place. Let me use Kaduna, for example. And then within a week, she was back from Kaduna.
Okay.
She escaped from Kaduna, from our people, back to where we were as at then, just to make sure that she is in sight of Rufus. Now it became so threatening that everyone got scared. Everyone is now scared of the entire situation. Could we describe this as being bipolar? Because she used to be very, very generous. As long as she's seen Rufus, she could give you, in fact, her eyes. She was, in fact, everybody loved her when she's happy. She's always very, very loving when she's happy. But as long as Rufus is not there, you would have a different switch.
So, well, it I can't put my foot down that she's this, because you don't have a full picture of this, the story. And because and another thing is that usually it's how they want you, what they want you to hear. But if you interview her, you understand she's the one feeling it. So I'll be able to ask some questions. I'll be able to make me know, this is what we are dealing with. This is what we are dealing with.
Okay.
So I can't like put her into. I can't fit her into a diagnosis. But from the symptoms, she's stalking Rufus.
Definitely.
She's and then if you are stalking and it comes to such this extent, then first thing is that it should be both of them should be separated in every way. But the Rufus person should move away as much as she can from this lady.
Okay.
And then if that didn't work, then it can also lead to how do I put it? It can also lead to Cynthia being assessed for a mental health problem.
As a then, we're able to link her up with a facility.
Okay.
And then because it got so bad that she, in fact, you could imagine getting to the police station and the police told her to sit, and she's like, she tried to assault the police officer, saying why would you tell me to sit when the love of my life is still standing?
Okay.
And then everyone is like, in fact, it was so terrible.